The patients that the phase 3 trial is seeking to enroll are patients with higher risk factor disease. So while 80% of patients do well, many of the patients within that percent number are made up by patients who have lower risk early stage disease. We know that there's patients who have more advanced stage disease or higher risk factors who still have, unfortunately, a very high risk of having disease relapse, and those are the patients that make up that 20% relapse rate. So for those patients, then they go on to do transplantation, which we spoke about, and unfortunately, only around 40–60% of those patients might remain in remission. So we really want to improve outcomes for that patient population, and for that particular patient population, rather than de-escalating treatment like we might do for, say, the patient who has the high chance of already being cured and we want to minimize treatment, for that patient population, we either want to escalate the type of chemotherapy that they're using, which could be done through, say, the BCOP regimen, to try and use more chemotherapy to get a better outcome, and that's one approach. The other approach would be sticking with standard chemotherapy, which is used commonly in the US, which is ABVD, but adding something to it. So adding a targeted agent to make that chemotherapy work better.